Welcome to our exploration of potential avenues for managing ALS symptoms. ALS, or amyotrophic lateral sclerosis, is a rare yet devastating neurodegenerative disease with limited treatment options. The onset of ALS typically occurs between the ages of 60 and 70, with a higher incidence in men, though menopause appears to equalize the risk between genders. Research suggests a correlation between aging, hormonal shifts, and the onset of ALS. Genetic mutations, such as those involving the superoxide dismutase enzyme, contribute to oxidative stress, damaging the nervous system and muscles. While ALS's autoimmune nature remains debated, evidence points to factors like spinal injuries, calcium buildup, and heavy metal exposure. ALS appears to have a complex relationship with hormonal balance, particularly postmenopausal hormonal shifts. While estrogen and melatonin levels decline, follicle-stimulating hormone ESH and luteinizing hormone LH increase. These hormonal changes may exacerbate ALS progression. Progesterone emerges as a key neuroprotective hormone. Experimental studies suggest that progesterone promotes autophagy, the process by which damaged cells are cleared and new cells are generated. This mechanism could potentially aid in mitigating the effects of ALS on the nervous system. Supplementing with pregnenolone, precursor to progesterone, ensures the body has the necessary building blocks to produce adequate progesterone levels. Melatonin, known primarily for its role in regulating sleep-wake cycles, also exhibits potent antioxidant properties, particularly within mitochondria. As ALS patients often experience oxidative stress, supplementing with melatonin could help counteract this imbalance. By boosting antioxidant defenses, melatonin supplementation may contribute to protecting neurons from damage and slowing disease progression. Oxidative stress plays a significant role in ALS pathology, leading to neuronal damage and muscle degeneration. Therefore, strategies aimed at bolstering antioxidant defenses hold promise in managing ALS symptoms. This natural compound, found in red wine, grapes, and certain berries, is renowned for its antioxidant properties. By scavenging free radicals and reducing oxidative damage, resveratrol may help mitigate neuronal injury in ALS patients. Calcium dysregulation and the accumulation of soft tissue calcium are implicated in ALS progression. Vitamin K2 plays a crucial role in calcium metabolism, directing calcium away from soft tissues and towards bones and teeth. By promoting calcium balance, vitamin K2 supplementation may help prevent calcium-related damage in ALS patients. Adequate intake of essential nutrients, particularly B vitamins, is crucial for overall health and neurological function. However, ALS patients may have increased nutritional requirements due to the metabolic demands of the disease and potential nutrient deficiencies. Ensuring sufficient intake of B vitamins, particularly in their natural forms, supports various cellular processes essential for neurological health. B vitamins play roles in energy metabolism, neurotransmitter synthesis, and DNA repair, all of which are relevant to ALS pathology. While not directly addressing hormonal or antioxidant imbalances, infrared therapy may complement other interventions by enhancing melatonin production. By stimulating the body's natural production of melatonin, infrared therapy could further support antioxidant defenses and potentially aid in symptom management for ALS patients. Stem cell therapy has garnered attention as a potential treatment for ALS. Due to its regenerative properties and ability to modulate the immune response, stem cells can differentiate into various cell types, including neurons, offering the potential to replace damaged cells and promote tissue repair. Stem cells have the capacity to differentiate into motor neurons and other cell types affected by ALS, potentially replenishing lost or damaged cells. Stem cells secrete growth factors and cytokines that support neuronal survival, reduce inflammation, and promote tissue repair. ALS is associated with neuroinflammation and immune system dysfunction. Stem cells can modulate the immune response, suppressing harmful inflammatory processes and promoting tissue healing. Several clinical trials have been conducted to assess the safety and efficacy of stem cell therapy in ALS patients. These trials typically involve the transplantation of stem cells into the spinal cord or cerebral spinal fluid. Some studies have reported promising outcomes, including stabilization of disease progression, improved motor function, and prolonged survival in ALS patients receiving stem cell therapy. Despite encouraging results, challenges remain, including the need for standardized protocols, optimal cell sources, and long-term monitoring of patients. Additionally, ethical considerations, regulatory hurdles, and the potential for adverse effects necessitate careful evaluation of stem cell therapies for ALS. Ongoing research aims to refine stem cell transplantation techniques, optimize cell types and dosages, and enhance the survival and integration of transplanted cells. Combining stem cell therapy with other treatment modalities, such as gene therapy, growth factors, or pharmacological agents, may synergistically enhance therapeutic outcomes. Tailoring stem cell therapies to individual patients based on disease stage, genetic profile, and immune status could improve treatment efficacy and minimize risks. Stem cell therapy holds promise as a potential avenue for managing ALS symptoms. By promoting neuroprotection, tissue repair, and modulation of the immune response, while further research and clinical trials are needed to validate its efficacy and safety, stem cell therapy represents a promising frontier in the quest to develop effective treatments for ALS. Thank you for joining us on this journey of discovery. Together, let us remain committed to advancing ALS research and supporting those affected by this complex disease. Remember, hope is our greatest ally, and with unity and determination, we can overcome any obstacle in the fight against ALS. See you next time.